Hello students, so today we are going to deal with another new topic, that is KMC, which we call it as Kangaroo Mother Care. So Kangaroo Mother Care, that is KMC. So by the word itself it says that is how a kangaroo carry his baby in his pouch. In the same way the mother also carries the baby in her chest. So that is why we have clearly set the term as kangaroo mother care. That is a kangaroo mother and a care. So today we are going to deal with this topic, why kangaroo care is important for the baby. Why the kangaroo mother care is important? Because with the help of, like a kangaroo, how he carries his baby in his pouch to protect the baby from various kinds of difficulties, to keep in between the chest so that the warmth can be given to the baby, as well as a good bonding develop between a kangaroo and his baby. So in the same way, the mother also keep his baby in her chest so that proper warmth it can be get to the baby, as well as a good bonding develop between a mother and a baby. And in the same way, how with the body temperature, with the mother's body temperature, the weight gain of the baby also happens. So it is a very good and a beneficial technique for the babies, especially because it helps in increasing the weight of the child. So there is proper weight gain that should be needed by a baby, right? So let's come to the introductions about this KMC. So of the 20 million low birth weight infants born globally every year, about 8 million are in India. So we can see the statistical calculations related to the delivery of the baby. Even we see, so we can see that of the top 20 million LBW infants, that is low birth weight infants. So low birth weight infants are those infants whose birth weight is less than 2500 grams. So those baby we call it as LBW babies. So we can say of the 20 million LBW infants born globally every year, that is every year 20 million LBW babies born, and out of which 8 millions are in India itself. So we can say of this 20 million, 8 millions are in India. Over 80% of neonatal death occur among small infants. 65% are attributable to preterm infants. So we can say that of this baby who delivers, out of which 80% of the neonatal death happens. You can just see how much big this number is. 80% of the neonatal death happens among small infants, and 65% are attributable to preterm infants. So we can say that small infants, they die because of some other diseases, and 65% of the preterm infants are there which are attributed, and 19% to term small for gestational age. And we can say among that also, say 19% are those neonates who are small for gestation age. We used to call it as SGA. So this statistical calculation, it is being given by Learn Every Newborn Lancet series 2014. So we can say that according to this Learn Every Newborn Lancet series 2014, it says that of the 20 million LBW infants which is being born globally every year, 8 millions are there itself in India, and out of which we can say 80% neonatal death occurs among small infants, which are 65% attributed, 19% are small for gestation age. So if we see the more amount of the calculation, you can see that India has the highest number of preterm births and also account for maximum number of neonatal deaths. So we can say that if we see the statistical calculations, we can know that India is the leading number of preterm birth, right, which has an account for maximum number of neonatal death. That is, maximum number of neonatal death occurs during this period. Why? Because of prematurity. Due to prematurity, incidence of LBW in India is about 27% of the total live birth. So we can see that incidence of this LBW infant is about 27% of the total live birth. So these were the incidents that we known how much percentage of the neonates are born, and out of which how many percentage of neonates which die, or we can say which suffers from the various neonates diseases or in disorders, right? So, or we can say the LBW infants which die of any kinds of disease. So what is the solution of this neonates death, or we can say how we can control this neonatal death, right? So for this, very good method is a kangaroo mother care, right? So kangaroo mother care, it is a method of care of preterm infants. So we can say that this LBW babies, when they deliver, if they are being immediately given to the mothers and the mothers start with the kangaroo mother care, then we can say that this neonatal death can be controlled. The method involves infant being carried usually by the mother with the skin to skin contact. So we can say that how this kangaroo mother care is being given. This method involves infant being carried, that is the small neonates or the infants are being carried by the mother with the skin to skin contact, that is there develops a good skin to skin contact. This guide is intended for health professional responsible for the care of LBW and preterm infants. So we can say that this guide that we told, right, like the babies should be kept between the mother's chest, and the baby should be provided proper skin to skin contact. This should be guided by the we can say the professional health professionals who are basically caring for this LBW babies and also for the preterm infants. Designed to be adapted to local condition, it provides guidance on how to organize services at the referral level and on what is needed to provide effective kangaroo mother care. The guide includes practical advice on when and how the kangaroo mother care can be applied. So we can say that what does this basically guide contain? The guide basically contains some of the practical advices, right, on how this kangaroo mother care care to be given, or how this kangaroo mother care method to be provided to the persons. So kangaroo mother care, it is a low resource, evidence based, high impact intervention and standardized care of LBW infants. So we can say that kangaroo mother care, it is a very low resources, that is we don't have to go to the market or we have to buy it. We can easily get ourselves within, it's not expensive at all and it is not needed of any kind of resources also. So we can say it's a low resource, evidence based, high impact intervention. High impact interventions in which we can say that for a minute amount or for a minute resources, we are getting a good intervention package and a standardized care of LBW infants, and there is a good standardized care of, that is we are providing a good quality care to the LBW infants, which like breastfeeding should be a part of routine care. And you have to make sure that while giving this kangaroo mother care, we should continue the breastfeeding. We should not stop the breastfeedings. It should be continued because the baby needs nutrient. So nutrient would be getting from the breastfeeding. So it can prevent up to half of all death in infant weighing less than 2000 grams. So we can say that if correct duration we are giving the infant kangaroo mother care, half of the neonatal death can be easily reduced. So we can know that if the baby who is less than 2500 gram should be given kangaroo mother care, right, which is a very, we can say, effective method of increasing the weight gain to prevent any kind of diseases, to maintain a good, to give a good warmth to the infant and also to develop a good bonding between a mother and a baby. So this is all given by Lon et al. 2010, which says that kangaroo mother care, it is basically a low resources, evidence-based, high impact interventions and a standardized care of LBW infants, which while giving this you have to continue with the breastfeedings. It can prevent up to half of death in infants who are weighing less than 2000 grams. So this was all regarding the introductions about the kangaroo mother care. Now let's see the history behind KMC. What is the basic history behind this KMC? So KMC was named similar to how marsupials carry the young in their pouch. Marsupials, so we can say here we are referring the marsupials as kangaroo. Okay, we are referring the marsupial as kangaroo. So KMC was named similar to how marsupials carry their young in their pouch. So we can say that how a kangaroo carrying his baby in his pouch, in the same way this name has came. So this name has been derived basically from the marsupials. So it was developed in 1970 to care for infants in country where incubators were either unreliable or unavailable. So we can say that it was basically developed in the year 1970. Which year it developed? It basically developed in the year 1970. And 1970, we can just imagine those years in which where the highly advanced technology was very rare in number. And if there was a high advanced technology, there also might be certain chances will be there that they might not be working, or there can be a shortage of the electric supply, and so this method cannot be adopted. So while the researcher going around this, they have seen it and they have applied this method, where we can say this researcher that they have gone deep into this research and they have come up with this topic. And you can say that we can basically provide this kangaroo mother care with no facilities we required, right? We don't need highly advanced technology or highly advanced any methods to which we are dependent on, right? If we are getting enough of if we are getting just kangaroo mother care, the baby's birth weight will be increased to its normal level. So we can say this KMC, it was developed in the year 1970. Why? To care for those infants in countries where incubators were either unreliable or unavailable. So more than 20 million babies are born with LBW babies. 7.8 million LBW babies are born in India only. So we can say that more than 20 million babies are born with LBW, in which we can say that 7.8 million LBW babies are born in India only. So we can say that among this 7.8 million babies, they are born itself in India only. So carrying a low birth weight is a great challenge for the neonatal care unit as well as for the family. So we can say that carrying a LBW baby, and as well as those family who are making sure that the baby should be safe, it should be provided a good care, it is really a great challenge for those people. By having a skin-to-skin contact, it stimulates the protective and nurturing environment of a kangaroo pouch. By having skin-to-skin contact, it stimulates the protective. So we can say that if you're having a good skin-to-skin contact, you are showing a protective nature and also giving nurturing environment like a kangaroo, right? You can see in this picture also how a kangaroo, he carries a baby pouch. And the baby is inside his pouch. That is, the baby feels secure, the baby feels protected from any harmful things, and as well as it is like a nurturing environment. And you can see if the baby is in its pouch, there is a good bonding developed between a mother and a baby, and the mother can easily watch his baby. He don't have to go here and there, or he don't have to search for the baby. The mother can easily see his or keep a watch on her baby. So we can say how a marsupial carries his baby in his pouch, in the same way the mothers also carries the baby in her chest. So this was the history behind the KMC. So now let's move on to the definition. So kangaroo mother care, which we call it as KMC, it is a simple method of care for the low birth weight infant that includes early and prolonged skin-to-skin contact with the mother or a substitute caregiver, and an exclusive and frequent breastfeeding. So we can say that what is kangaroo mother care? So kangaroo mother care, it is a simple method of care for LBW infants. It is very a simple method of showing care to the LBW infants. LBW infants, we can say that the low birth weight infant. That includes early and prolonged skin to skin contact. That is the mother and the baby is having a good skin to skin contact. Now, this good skin to skin contact is not only for a limited durations. You can use this technique for a longer duration, for a longer period. Or a substitute caregiver. So this KMC, it is not necessary that only the mother should give. The father can also give, the grandmother can also give, and even the grandfather can also give this KMC to the baby. That is why we have termed as substitute caregiver. So we can say the substitute caregiver can be father, it can be grandmother, and it can be grandfather also. Okay, so these are the 3 persons who can act as a substitute caregiver. Right? So what is kangaroo mother care? Oh, okay, and substitute caregiver and exclusive and frequent breastfeeding. Exclusive and frequent breastfeeding, why we have used the 2 words? Exclusive means compulsory breastfeeding should be given, and frequent breastfeeding refers to in interval the frequent breastfeeding should be given to the baby, and thus after that you can continue with the kangaroo mother care. So how can we define kangaroo mother care? It is a simple method of care for the low birth weight infant that includes early and prolonged skin to skin contact with the mother or a substitute caregiver and exclusive and frequent breastfeeding. So this natural form of human care, it stabilizes body temperature, promotes breastfeeding, prevents infection and other morbidities. So we can say that if the particular person is continuing with the kangaroo mother care, right? So what are the things that is being changes that must be taking place? That is, it stabilizes the body temperature. Stabilizes the body temperature, that is the mother's and the baby's body temperature is come to a normal level. Promotes breastfeeding, that is we are promoting exclusive and frequent breastfeeding we are giving, right? Next is preventing infections, that is if the baby in the mother's pouch, he had been prevented from various kinds of infections and other comorbidities or other, we can say, the risk factors. This also leads to early discharge, better neurodevelopment, and encourages bonding between mother and infant. So we can say that it also leads to early discharge, that is if continuous kangaroo mother care it is being given to the babies, right? So the weight gain will increase, body temperature will stabilize, a good body bonding develop between the mother and a baby, and various kinds of comorbidities can be prevented, right? So in this way the baby can be early discharged from the hospital. Better neurodevelopment, how better neurodevelopment happens? Because the 5 senses get active, and in the same way the proper blood flow is being there inside the brain, because it's a good bonding. So bonding, it basically it not only prevents various kinds of diseases, but it also feels a sense of care, a sense of feel of happiness, and a sense of feel of well-being between a mother and a baby. So neurodevelopment and encourages bonding between a mother and a infant. So the KMC is initiated in the hospital and continued at home until the infant needs it, and for optimum care at regular follow-up must be ensured. So what it is being told that this KMC, it should be continued in the hospital also and also in the home also after discharge until the infant needed, that is the time the infant needed, it should be given for optimum care. Why? For the optimum care, and also for the follow-up must be ensured. That is, you have to make sure that you should go at regular interval to go for the follow-up. So we can say, what is KMC? It is basically a natural form which basically stabilizes the body temperature. It promotes the, we can say, breastfeeding. It prevents infections and also prevents various kinds of comorbidities. And if KMC is being continued, then there will be early discharge, there will be better neurodevelopment, and we are also encouraging a good bonding between a mother and a infant, right? So it is not necessary that KMC should be initiated only in the hospital. So after the discharge, this KMC can be continued even in the home also. Now, there are various components of KMC. So, we can say that Kangaroo Mother Care has the following components. What are the components? There are basically two components, that is skin to skin contact and second is exclusive breastfeeding. Okay, so first is skin to skin contact and second is exclusive breastfeeding. So, skin to skin contact, you can say early, continuous and prolonged skin to skin contact between mother and baby is the basic component of KMC. So, what is actual thing that is happening in KMC? That is, we are providing a good skin to skin contact between a mother and baby, right? So, this is basically a basic component of Kangaroo Mother Care. The infant is placed on her mother's chest between the breasts. So, we can say that the infant is placed between the mother's chest. That is where the infant is placed on her mother's chest between the two breasts. So, that is first components, that is skin to skin contact. The skin to skin, we can say that early and prolonged continuous skin to skin contact between mother and the baby is the basic component of KMC, and in this the baby is being kept between the chest, we can say on her mother's chest between the breast. The second is exclusive breastfeeding. The baby on KMC is breastfed exclusively. Skin to skin contact promotes lactation and facilitates the feeding interaction. So, we can say that while having the skin to skin contacts, the baby develops or promotes, or we can say the mother promotes the lactations, and thus it facilitates the feeding interaction also. So, that is why it is being told that every 2 hours continuous and exclusive breastfeeding should be given to the baby. So, exclusive breastfeeding is very important for the baby as it helps in proper it should be given proper nutritious, we can say nutrient, as well as we are promoting a good vitamins and the minerals that should be essential for the babies. So, what are the components of KMC? There are basically two components, that is first is skin to skin contact and second is exclusive breastfeeding. Now, next move on to the various prerequisites of KMC, right? So, there are two prerequisites of the KMC. First is support to the mother in hospital and at home, and second is post-discharge follow-up. So, first is support to the mother in the hospital and at home. So, what comes in that? A mother cannot successfully provide KMC all alone. It is a saying that mothers should only give the KMC. No, it is not at all necessary. The father can also give the KMC. Even the grandmother and the grandfather can also give the KMC. Any family members can provide the KMC to the baby. So, a mother cannot successfully provide KMC all alone. Why she cannot provide successfully all alone? Because she cannot take 24 hours baby in her chest, right? So, it is the responsibility of each and every member from the family to take this responsibility. That is, every 2 or after 4 hourly, they should take the responsibility and carry out. She should require counseling along with supervision and care provided. So, what she need is that she need a proper counseling also, and along with that she needs supervision. Why supervision? Whether the baby is in correct positions, and whether the baby is taking the good breastfeeding or not, or whether the mother is facing any trouble, or whether the baby is facing any trouble. Supervision is very necessary while providing the KMC. So, she should require counseling along with supervision from the care providers and assistance and cooperation from her family members. Now, cooperation, this is a big term, cooperation from her family members. Why? Because cooperation is at most needed, right? Because if the family members is not cooperating to give the KMC, so it will affect the baby only. So, every members has to give the cooperations from their side. So, first is support to the mother in the hospital and at home. We can say that a mother alone cannot provide alone all the KMCs. Second is she require a good counseling and also supervisions from the care providers, and also assistance and cooperations from her family members. Second is post discharge follow-up. So, we can say the KMC is continued at home after early discharge from the hospital. So we can say that after the discharge from the hospitals, the KMC is being continued. A regular follow-up and access to health providers for solving problem are crucial to ensure safe and successful KMC at home. So we can say that a regular follow-up, that is a good follow-up after every KMCs, and access to health providers, that is in every follow-up you should meet your pediatricians for solving any kind of problems to ensure safe and successful KMC at home. That is to make sure that the baby is taking a safe and a successful KMC at home also. That is why post-discharge follow-up should be made. So the two prerequisites of KMC are, first is you have to support the mother in the hospital and at home, and second is post-discharge follow-up. The post-discharge follow-up should be made as to aware about the any disorder or any problem that is being happening to the child, or whether the child is not taking the feed properly, or any kind of problems that the child is suffering from. Now next is LBW. What is low birth weight baby, right? We have been telling many things about the low birth weight babies, right? So what is low birth weight babies? So low birth weight or LBW has been defined by the WHO as weight at birth less than 2500 grams. So we can say that LBW babies are those babies whose birth weight is less than 2500 grams, which can be a consequence of preterm birth or due to small size for gestational age or both. So we can say that WHO says that LBW are those babies whose birth weight is less than 2500 grams, which can be a consequence of the preterm birth. Why? Because due to small size for the gestational age or both. So preterm is defined as born before 37 weeks completed, and SGS, small for gestation age, is defined as weight for gestation less than 10 percentile of the gestational norm. So we can say that who are preterm? Preterm is defined as those babies who are born before 37 weeks of their gestational age. And how can we define short for gestation age? That is small for gestation age. It is defined as weight for gestation less than 10 percentile of the gestational form. So that is, we call it as low birth weight, that is the LBW. Now what is required for implementing this KMC? What are the various things we require to implement this KMC? So first thing we require is the infrastructure. Okay, so what is the first thing we require? We require an infrastructure. Infrastructure means we need a good infrastructure. We need a good spacious facilities where the mother can sit with her baby, right? And even this KMC, when provided, the mother is being advised to use a KMC chair. That is, she can sit on a KMC chair and she can support her baby. So dedicated space near special newborn care unit, that is SNCU, postnatal ward or neonatal ward, or we can say which is furnished with comfortable reclined chair and cots. So we can say that we need a good spacious space near where? Special newborn care unit, that is SNCU. We need a good space near SNCU or postnatal ward or neonatal ward. That is, we need enough of space either near this special newborn care unit or postnatal ward, or we can say the neonatal ward. And it should be well furnished with comfortably reclining chair. Comfortable with what? Reclining chair. Reclining chair are those chairs in which the mothers can be relaxed. Mother can sit and relax, and she can keep her baby in a very relaxed way. And codes, it provide privacy for expression of breast milk. And if this area is well furnished, so she can also get privacy. Why? For expression of the breast milk, and is equipped with storage facility for express breast milk. Why? She need a good privacy so that she can give the breastfeeding also, she can express her breast milk also, and also she can store this breast milk. she can store this breast milk in a storage container also. So first thing we required is a good infrastructure. So we can say in infrastructure that it should be dedicated space near the special newborn care unit or the postnatal ward or the neonatal ward, and it should be furnished with a good reclining chair, cot, and also it should provide privacy for the expression of breast milk, and it is being equipped with the various storage facility for the express breast milk. Now second is human resources. The first was infrastructure, now second is human resources. So human resources, we can say the availability of adequate number of trained and willing health service provider for 24/7 service is most crucial for assisting mother in the KMC practice and LBW feeding. So we can say that human resources, in human resources we can say the availability of adequate number of trained and willing health care service, that is the health care providers, whoever is there, right, they should be properly trained, and willing service health providers, that is they should be willing to give the proper health care to the particular mothers as well as the newborn. For 24/7 service, this is most crucial for assisting mother in the KMC practice and LBW feeding. So we need a good 24-hour care services so that this mother can be watched, or this mother can be watched for supervisions, and if any assistance is required to the mother, it can be provided, and also to practice the low birth weight baby feedings. So we can say the second point is the human resources. So in human resources we can say that there should be adequate number of trained and willing health services provider who can give services 24/7 providers, right? And it is being very crucial for the mothers. Why? Because if mother is needed for any assistance, so these staff are there to help them, and if they want to practice the feeding, they can be given to the feeding. So second is human resources. Now the third is the IEC. IEC is what? IEC is basically the materials that we give to the mothers requiring the kangaroo mother care, in which there is a full information regarding the kangaroo mother care. What is the benefits, or what are the various uses, what is the importance, various positions of giving the kangaroo mother care, and what all are the various advantages and disadvantages. So these materials can be given to the mothers or the families or even to the community. So we can say that ensure adequate IEC material including video films on the KMC in local language of mother, family and the community. So we can say that we can give the sufficient IEC materials which includes the various video films on the KMC in the local language of the mother, families or in the community. Local languages are those language wherever, whichever language is being preferred, we give the informations in the local language. Counseling of the mother, father and relative by service provider is catalytic in ensuring KMC practice during their stay at the hospital. So we can say that counseling should be given to the mother, to the father and also to the relative service provider, which is being very basically very important to give the KMC during their stay at the hospitals and also after the discharge, so that they can continue to practice KMC till the infant requires it. So first the KMC is being given in the hospitals and next the KMC is being continued in the home also, right? Where we can say this KMC should be given to the infants whenever the infant requires it. Community awareness activities should be conducted to maximize the benefit of KMC and breastfeeding. So we can say that in community areas also we should provide the informations to the mothers so that they can practice this KMC in their own area, right? And in this way it is being very beneficial and it is being very benefits for the mothers who are staying in the community area. So we can say this counseling of the mother, father and the relatives by service provider, it's very important to ensure that the KMC, it is being practiced during their stay in the hospital also, while they are being discharged from the hospitals, when they are in home also, and they should practice this KMC till the infant requires it, right? And especially this KMC awareness should be given to those population who are residing in the community area, because there is a problem related to the people's communication also and the people information. They are not having enough of informations regarding the kangaroo mother care, and if they knows about the information also, they feel shame to practice this we can say this technique, because it is being a saying that it is in this posture there is a complete skin to skin contact, so it is not easy for the people residing in the community area to accept this technique. So for them, more and more informations regarding the KMC should be given, why this KMC is important and what is the benefits of giving the kangaroo mother care. Now, so this was all regarding what is required for implementing the KMC. First is infrastructure, second is human resources, and third is the IAC material. Next is which infants should be provided KMC, that is, which are the various infants that should be provided with the KMC. So, though all the LBW infants should be provided KMC, but considering the huge burden at facility, priority must be given to infant with birth weight less than 2000 grams. So we can say that though we can say all LBW infants, they should be provided with the KMC, but huge burden means huge number of children are born with less than 2500 gram, right? So we can tell that it can be compulsory provided to those babies whose birth weight is less than 2000 gram, right? So we can say which infant should be provided with the KMC. Though all LBW infants, they should be provided KMC, but what you have to think is that, but considering the huge burden or responsibilities at the facilities, this priority must be given to those infants whose birth weight is less than 2000 grams. So for those infants, this KMC should be provided. Next, so this was all regarding the what is basically required for the implementing the KMC. We need good infrastructure. Second is we need good resources, we need the various IEC materials, and which baby should be given KMC. Now next is time and initiation of KMC, that is at what duration this KMC should be given. So first is the birth weight less than 1800 gram and less than 2500 grams. So first important is those baby whose birth weight is less than 1800 gram and less than 2500 gram. These infants are generally stable at birth. So we can say that these infants, they are basically stable at birth whenever they are being born. Therefore, in most such cases, KMC can be initiated soon after the birth in the postnatal ward. So we can say that in such cases, this KMC can be initiated as soon as the baby delivered in the postnatal ward. This KMC can be given to the baby. The neonate weighing less than 2000 grams should be accorded priority for initiation of KMC, considering the huge burden of LBW infant in the country. So we can say that because there are various many babies who are being born whose weight is less than 2500 gram, right? So the thing is that you can just summarize this thing by just focusing on the thing that it should be given to those baby whose weight is less than 2000 gram. So we can say that the priority wise, the proper KMC technique can be given to the baby. For the initiation of KMC, huge burden of LBW infants in the country, because there are, we can say that if we see the estimates duration, every 5 minutes there are one baby born, right? So there, it is not necessary that every baby should be born with a birth weight of more than 2.5 kg. Right? So it is being told that those neonates whose weight is less than 2000 gram, they should be given priority, and for them this KMC can be given. So first time and our initiation of KMC we can see is that first point is birth weight more than 1800 gram and less than 2500 gram. Now second is birth weight more than 1200 gram and less than 1800 gram. Okay, so now the second, we can say the initiation or time on initiation of giving this KMC is first and second is birth weight more than 1200 gram and less than 1800 gram. So many infants of this group have significant problem in the neonatal period. So we can say that many infants who are born in this age group, they are having some or the other kind of a problem, right? It might take a few days before KMC can be initiated. So we can say that it takes few days when this KMC can be initiated. Such infant may need care in special newborn care units. So these infants, they need care in special newborn care unit, that is special newborn care unit, SNCU. They need care in special newborn care unit, that is the SNCU, or a newborn intensive care unit, or we can say or the newborn intensive care unit, that is the NICU. So intermittent KMC can be given to hemodynamically stable infant receiving IV fluids, antibiotic and even oxygen. So we can say that this KMC can be given to those baby also who are hemodynamically stable, that is who are there in NICU but who are hemodynamically stable. To those baby also we can provide the KMCs. And to those infants who are receiving IV fluids, that is the intravenous fluids, right, antibiotics, and who are under oxygen, for them also we can give this KMC. So KMC should be practiced under medical supervision. The duration may be gradually increased and therefore the infant may be transferred to a dedicated KMC. So we can say that this intermittent KMC, it is very much beneficial for the baby, because it is keeping the baby stable, hemodynamically stable, and it can be given to those baby also who are in IV fluids and who are being given antibiotic, and also those babies also who are being under oxygen. So we can say this KMC should be practiced under a medical we can say practitioners or medical supervisions. And firstly, when the KMC is being started, right, the KMC should be gradually, it should be slowly increase. The duration should be slowly increase, and therefore the infant may be transferred to a dedicated KMC ward. Now the next is birth weight less than 1200 gram. Next is birth weight less than 1200 gram. So these infants frequently experience serious prematurity related to morbidity, often starting soon after the birth. So we can say that birth weight less than 1200 gram, in which these infants, they frequently experience serious prematurity related to morbidity, often soon after the birth. It may take days to weeks before the infant condition allow initiation of KMC. So we can say that it basically takes days to weeks before the infant condition allow initiation of KMC. Duration of KMC should be gradually increased based on the tolerance of the infant. So we can say that whose birth weight is less than 1200 gram, they are very sensitive baby, right, in which because there is serious prematurity, right, related to morbidity soon after the birth, and for them to come to a normal state, it takes time, right. So we can say for those babies it may take days to week also, right, to allow for the KMC. And the duration of this KMC also should be increased, but you have to make sure that you should see the tolerance level of the infant also. So we can say these all are the various time and initiation of KMC. Birth weight more than 1800 gram and less than 2500 gram. Birth weight more than 1200 gram and less than 1800 gram. And birth weight less than 1200 gram. So you can see in the flow chart also, this is the time and initiation of KMC. Birth weight we have divided into 3 phases, that is less than 1200 gram, more than 1200 gram, and more than 1800 gram, and less than 22,500 gram. So if the birth weight is less than 1200 gram, most infants suffer from serious morbidity. Therefore, birth should take place in specialized centers. So if because this birth weight is too low, that is 1200 gram, right, less than 1200 gram, so we have to make sure that their birth should take place in a specialized centers, and in this way it takes days to week before KMC can be initiated. So we can say for those baby to get stable or to get start with the KMC, it may take certain days to week to come to a normal state to start with the KMC initiation. Now, if the birth weight is more than 1200 up to less than 1800 grams, so we can say if the birth weight is more than 1200 and less than 1800 gram, so for them, many infants suffer from serious morbidity. Transfer to a specialized center if possible. Then you have to transfer to a specialized center if possible. Best transported in STC with mother and family member if transported incubator not available. And it may take before KMC can be initiated. So it may also takes time to start with the KMC, because the main motto is to make them useful or make them available of all that things that can save the life of the patients, right? So for them, we need to give antibiotic, we need them to be in the warmer or the incubator, right? Or there can be conditions that these children can be there in the ventilator to come back so that their normal oxygen process can be started, right? So after that also we can initiate the KMC. Now, if the birth weight is more than 1800 up to less than 2500 gram, so for them, the baby should be generally stable at birth and KMC can be initiated immediately after. So, more than 1800 and less than 2500 gram, in which we can say that these babies are generally stable and the KMC can be initiated immediately after birth. So this is basically the flow chart for the time of initiation of KMC, in which we have divided into 3 birth weight, that is birth weight less than 1200 gram, birth weight more than 1200 gram and less than 1800 gram, and birth weight more than 1800 gram and less than 2500 gram. Now our next question is who can provide KMC? Right? Who can give the KMC? So KMC, it can be provided by mother, father and other adult family members. So it is not necessary that the KMC should be given by the mother. No, the KMC can be given by the father, can be given by the mother and other adult family members. The KMC provider should be willing, in good health, free from serious illness, and should maintain basic standard of hygiene such as hand washing, daily bath, clipped fingernails, tied up hair and clean clothes. So basic precautionary measures that the person has to make sure that they should be willingly, they should be willingly ready to provide the KMC. In a good health, that is, they should be free from serious illness and should maintain basic standard of hygiene, that is, they should maintain a good standard of hygiene such as daily hand washing should be done, bathing should be done, clipped fingernails, that is, the fingernails should be short, tied up hair, that is, the hair should be tied up in a very good tidy way, and also she or he should wear a good clean clothes. So these are the various things that the adult has to make sure that they should maintain. That should first is KMC is not only the responsibility of the mother. The KMC can be provided by the mother, by the father and other adult family members. It includes grandmother and grandfather. And the second utmost thing is that the KMC giving person should be willingly ready to give the KMC in a good health, which is free from serious health illness, and also she should or he should maintain a proper standard hygiene such as hand washing, daily bath, clipped fingernails, tied up hairs and clean clothes. It is recommended that jewelry, watches and sacred thread must be removed, as they may be a barrier to maintain hygiene and may cause injury to the newborn. So it is being told that any kind of jewelry, any kind of we can say the watches or any kind of thread, right, it should be removed while giving the KMC. Why? Because it can provide or it can give the obstruction to the child, or also it can give infection also to the newborn. So I am sure that now you might be clear about who all are the person who can give KMC and what all are the various precautionary measures a person has to keep in mind while providing KMC. Now next is how to provide KMC, how you can provide this KMC. Now first thing is counseling. So counseling, we can say effective counseling for the initiation of KMC is a prerequisite to overcome socio-cultural barrier and anxiety regarding handling LBW infants both by the mother and other care provider. The first thing is that effective counseling, that is a good counseling should be given. Why? For the effective initiations of the KMCs and also to overcome various socio-cultural barriers and anxiety that is regarding the low birth weight infant by the mother as well as by the healthcare providers. Now, when giving this KMC, the mother, father, adult, any member of the adult, they are having very anxiety related to giving KMC because they had a fear in their mind the baby will fall, but baby will not form. The baby will be tied with we can say with a cloth or with a binder so that the baby cannot fall. So when the infant is ready for KMC, the first counseling session should be organized at the time convenient to the mother. When we can say that when the infant get ready means when the birth weight is too low, 1200 gram, when the baby is in incubator, right, when the baby required incubator. So when the baby cure, or we can say when the baby recover from that being in the incubator, when the baby is ready to accept the KMC, proper counseling should be given to the mother, right? It should be given firstly to the mother. The first few sessions are important and require extended interaction to develop a rapport with the mother and to elevate any kind of fear. Now, the first interaction is very beneficial, or we can say very useful, because this is the first interaction when the mother will be given counseling regarding the KMC. So why this counseling is being basically given? To elevate any kind of fear whatever the mother is having in her mind, to clear any kind of doubt or query what is being going inside the mind of a mother. So first thing is the counseling, where we can say when the baby gets ready to receive the KMC, this is the first technique, or this is the first time when the mother need to be called for giving the KMC. And you have to give this counseling for an extended durations to maintain a good rapport and also to elevate any kind of fear. Next is KMC procedure should be demonstrated to her, explaining correct positioning in a caring, gentle manner and with patience. So we can say that this KMC procedure, it should be demonstrated to her by explaining correct position. So how you are going to demonstrate this KMC? You have to demonstrate this KMC by showing the correct positioning in a very caring, gentle manner and with a full patience. Her queries should be answered to allay her anxiety. Encourage her to bring her mother or mother-in-law, husband or any other member of the family. So you can encourage the mother to bring her husband or her grandmother, or we can say the grandfather of the baby, to come for the counseling session. It helps in building a positive attitude of the family and ensuring family support to the mother. And in this way, we are ensuring, or we are providing a good positive environment to the family. Also, we are giving sufficient informations also, and in this way, the mother is getting a good family support, which is particularly crucial for post-discharge home-based KMC. And this is, we can say, very important for the post-discharge home-based KMC. It is helpful that the mother and family members starting KMC interact with some already practicing KMC for her infant. So it is being very effective for the mother if the mother is being interacting with some other mother who is being giving the KMC. So in this way, the mother also feels confident, the mother also feels energetic. The mother showed willingness to give KMC to her baby. So first thing was counseling. Now second is clothing. Now the clothing is very important while providing the KMC. The KMC can be provided, okay, for the mother. For the mother, what the mother should wear? The mother can be provided using any front open, we can say any front open gown, Light dress as per the local culture. So we can say that the first thing is that the KMC can be provided by using any front open gown or light dress as per the local culture. KMC work well with sari blouse, gown or shawl. So we can say that KMC, it works very well with the sari blouse, gown or shawl. A suitable apparel like kangaroo bag, baby bag, sari, binder that can retain the infant there for an extended period can be adapted locally. And also we can say that various apparels are there nowadays, right, in the market, like the kangaroo bag, or we can say baby bag is there, sari, binder that can retain the infant for an extended period of time. So we can say, what is the clothing of the mother? The mother should wear an open gown, or we can say sari or a blouse or a shawl, right? And nowadays various apparels are available in the market, like the kangaroo bag, baby bag, sari, binder that can be tied, and in this way the baby can be retained for a longer period of time. Now second is, what kind of a dress the infant should be having? The infant should be dressed in a cap, socks, disposable diapers and front open sleeveless shirt or jhabla made of soft natural fabric like cotton. So we can say, what is the basically the baby wears? The baby wears a very nice fabric that should be made up of cotton, in which the baby will be wearing a cap, a socks, disposable diapers and a front or disposable diaper and a front open sleeveless shirt or a jhabla can be used. So baby, what the baby should be wearing? The baby should be wearing the cap, the baby should be wearing socks, a disposable diapers and also a jhabla, so that the baby can be there for a longer duration. There is no need to change the diapers and all, because the disposable diapers is already there, and in this way the baby can be retained there for a longer duration of time.